Hello, Walter McCone here. I thought I'd touch on the subject of chickenpox. What I'm going to do is mix NHS NICE guidelines with the works of McConnell from 1902, I think. Up-to-date information. Chickenpox or varicella is a common, highly contagious viral infectious disease in childhood, which we know. Usually mild, is characterised by a very itchy rash that can spread over the whole body. In the UK, it is common and most cases occur during the winter. And around 90% of the UK population have had chickenpox by the age of 15. It is not common in people from tropical and subtropical zones. That's interesting. The incubation period is usually between 7 and 21 days. After exposure to the herpes, varicella, zoster virus, to the development of the symptoms, which is quite interesting. The disease is most contagious a day or two before the rash appears, and until the rash is completely dry and scabbed off, about 5 to 6 days after onset of the rash. Now, who is at risk from chickenpox? Well, anyone who has not had chickenpox, number one. Number two, anyone who is not vaccinated against the varicella zoster virus, and young children, usually under the age of 10. Who is at risk from complications? Newborns and very young babies. Adolescents and adults tend to have severe forms and complications. Pregnant women who have not had chickenpox are at risk of complications. They can develop severe forms of chickenpox, including varicella pneumonia. Most people gain lifelong immunity after having chickenpox. They can develop severe forms of chickenpox, including the varicella pneumonia virus. Other people as well. Anyway, there we go. It may become activated at the herpes zoster or shingles in later life. Okay, so that's the NICE guidelines and whatever. Right, okay, so let's see what McConnell had to say way back then. So, varicella or chickenpox, easy to hold it up. Definition: chickenpox is an acute, specific, contagious, slightly febrile, eruptive disease, usually of childhood, affecting the whole organism through the blood. This is what he was saying. It is an epidemic disease that spreads rapidly. It is highly contagious but not inoculable and confers immunity. History: varicella was first recognised in about 1553, well, that's a long time ago, and was distinguished from smallpox by Trousseau. I haven't looked up Trousseau, so. Etiology: the agent that causes the disease is not known. The disease usually affects children under 10 years of age, so that's consistent, but does occasionally attack adults, which we know. It bears no relation to variola, except the very slightly similar eruption. It is transformed by direct personal contact, by air, or by a third person. So that's interesting. So contact by air, usually droplets, and even on clothing apparently. That's what the NICE guidelines say. It is infected from the first symptoms until all the crusts have disappeared. Although the disease usually occurs in epidemics frequently, we see sporadic cases. As in all other contagious or infectious diseases, the predisposing causative factors are those conditions which lower the resistive powers of the body, such as fatigue, improper diet, exposure to sudden temperature changes, and imperfect elimination of body waste. Now, I'm sure that naturopaths would agree to that as well. The structural lesions found are predisposing factors, are contracted muscles of the neck and behind the jaw, and muscular and interosseous lesions of the upper cervical, mid-dorsal, and dorsolumbar areas. Also of the clavicle and upper ribs. So that's interesting. All the way down to the sort of dorsolumbar region. Symptoms and diagnosis. There are 3 stages to the disease. 1, incubation. 2, prodromal. 3, eruptive. So, number 1, incubation period. Don't forget this is McConnell, still reading from McConnell. Incubation period. This period lasts about 14 days, that may vary from 7 to 17 days. So I think they were talking about 21 days anyway. During this period, there's practically no symptomatology, except perhaps the last 2 or 3 days when the child shows evidence of a little excitability and irritability. Often, on the day before the first notable symptoms, the child appears to be even more active than usual. So we get this hyperactivity, it's probably agitation. Number 2, the prodromal stage. Prodromal symptoms are not common and usually last about 24 hours. The first notable symptom is the irritability of the patient and is followed by a temperature of usually 99 to 101 degrees Fahrenheit. I haven't looked up Celsius. It's got to be over 39. The first notable symptoms of irritability. These are sometimes thirst, anorexia, constipation, seldom vomiting, and the classic furred tongue. Some cases have been observed to have the following as prodromal symptoms, but these we believe are usually due to concurrent conditions that exist at the time of the infection. Here we go. Delirium, convulsions, angina, conjunctivitis, dysphagia, bloody vomiting and stools, and an initial erythema, usually scarlatina forms, that's the skin, erupting. Number 3, the eruptive stage. The eruption comes within 24 hours and it's often the first symptom that is noticed. It appears first as hyperemic macules and then rose-coloured papular spots somewhat comparable to the typhoid rosella. These papules rapidly become raised, flattened, ovoid, pinhead to pea-sized vesicles containing a fluid, at first watery and then pearly. They disappear on pressure. It's interesting. It's quite diagnostic, I suppose. The vesicles mature within 24 hours, are very superficial and have a slight areola about them, which is not inflammatory as in smallpox. These vesicles are not umbilicated, but some have highly depressed centres, are discrete and appear in successive croups, which require from 3 to 6 days to complete. The itching is more or less intense. As scratching may cause pitting, it should be guarded against. So try not to get an itch. I'm sure that'll happen. Right, treatment. Isolate the patient so as not to come in contact with other children. The younger children should be put to bed until the crusts have formed. Older children may be allowed to be up and around the room if their cases are light. Pay particular attention to the muscular lesions of the neck, lower maxilla, mid-dorsal and dorsal lumbar region, keeping them relaxed by gently relaxing treatment. So I suppose you could use functional, gentle soft tissue, maybe traction. A general systemic treatment is soothing and helps to prevent complications. Now what McConnell does here, he quotes A.T. Still. Here's the quote. By very careful and very thorough in your neck adjustments, loosen the atlas and axis and draw forward the inferior maxilla from its pressure upon the vessels and nerves back to its angle. So I suppose maxilla mandible. Draw the hyoid bone forward and secure good circulation of blood throughout the entire cervical area. So that's a quote from A.T. Still. Give treatment at the fourth of his dorsals to stimulate the superficial circulation and thus increase elimination through the eruption as well as the sweat glands. So you're causing reactions by the upper ribs? Yeah, upper dorsals into the neck and head. Remember, the eruption is the expression of the body's attempt to eliminate the toxins within. So the eruption is the elimination process. Keep the bowels active by splanchnic and abdominal manipulations and by a laxative diet, or just good food. If bowels are persistently inactive, use enemata. So you can use enema. Well, okay, it's up to you. It's up to you if you want to do that. Where are we? Okay, so during the eruptive phase, do not use tub baths. So don't soak them in water. Daily tepid sponges with either plain water or boric acid solution. We're not going to go there. After daily sponging, after daily sponging and as often as necessary to control itching, anoint with a 10% boric ointment or a carbonized Vaseline. I'm sure we could find something I don't know, you could find something to use just to calm things down. Prognosis, inevitably favourable unless complications set in, which is seldom. Recurrences are very rare. Prophylaxis, the children should be kept in quarantine for 3 weeks or until the skin is entirely clean. There you have it from McConnell. What's the date on that? That date was, actually it was 1920. Anyway, I'm sure you can find your own ways. It's not about treating chickenpox. It's about managing it. It's about actually relieving some of the symptoms. 80 still always said treat any infection as though it was an injury. So the body's responding, hence the irritability of the child, the excitement. So, good fluids, loosen up the cervical spine, upper thorax, including the clavicles, pull out the hyoid, get the mandible, maxilla moving because of structures behind it. Thoracic, dorsal lumbar area, that would help the splanchnics area, that would help the diaphragm. I think that's about it, really. Anyway, I hope that helps.